Welcome back to the Q. My name is Lisa Maroney. I'm the Director of Business Development, and we're here with my go-to standard Q host, along with a special guest. So I'd like to first say hi to Jen. Welcome back, Jen.
Hi, so good to be back.
Good times. Hi, Karen. Thanks for joining us once again.
Hi, Lisa. Hi, Jen. Great to be here with you guys, particularly for this timely conversation we're going to have.
Yes, we've got another very exciting episode here today. I have a couple of really important questions to ask. So I'd like to first introduce Darcy Beall. She is our public nurse here in the Chelmsford Health Department. So welcome, Darcy. Thanks for joining.
Hello. Hi, thank you for having me.
Great. This is great to have you here. It is perfect timing. And we just wanted to ask a few questions. Obviously, COVID has disrupted pretty much everything and anything that affects anybody's daily life. And we will likely have to manage a new way and a new norm, as everyone has said. But I thought it would be great to first start off with just talking a little bit about your role as a public nurse and what that means to the community and how that works best, for our town here.
Yeah, so I joined forces with Sue Rosa downstairs at the Board of Health, just as the pandemic was starting back about a year ago, actually. And so she called me, and after I accepted the position, said, I need you to come in now. I was slated to come in later in April, but she called me early and said, the cases are getting crazy and I need some help contact tracing. So I orientated online via Zoom and started contact tracing. So that's my main function right now, is to contact trace, which means when someone becomes positive, their lab result gets sent to the state, which then comes to us because they live in Chelmsford. I get their report. We usually call them and ensure that anyone who has been in close contact with them is quarantining and testing appropriately. So that's my main function. The cases are starting to slow down here in Chelmsford, so I'm starting to discover more of my usual role, which is exciting. I haven't had a whole lot of time to do that, but that is my main function right now, is contact tracing.
I had no idea. I had no idea. I saw, you had arrived right when it first began, the pandemic began, and we were working remotely for a brief while, and then it was just complete pandemonium. So it's great to spend a little bit of time in conversation with you, aside from all the clinics and everything else you've been doing for the town. When I see you just, in a blur back and forth all the time, nonstop. So I appreciate the few moments here today to talk a little bit. I had no idea that the contact tracing was that very specific at the local level. I kind of knew it was happening, but gosh, I didn't know my actual coworker or colleague was, behind the curtain doing it all. So thank you so much for that.
The typical role for the public health nurse is still contact tracing, but usually it's with other communicable diseases. And we monitor maybe foodborne illnesses or tick-borne illnesses. So contact tracing is very much a part of my function, but with COVID, it was just all COVID contact tracing and very little of the other communicable diseases.
Yeah, so that's a safety measure that's here through your role for the community. If it's something that happens through a food product at a restaurant or a grocery store or any type of consumable, right?
Absolutely.
Is that fair to say? Yeah.
Yep.
Yeah. Well, Karen's dying to ask that question. I see your hand going up. Go for it, Karen.
I wanted to ask you, if I have been contact traced, what will you say to me on the phone? What kind of information will you give me about that?
So first and foremost, I would kind of determine what kind of contact you had and when you had it. If you had contact recently, I would say, let's look at how the contact was. Were you in a small enclosed area? Was it, within 6 feet, with masks, without masks? When was the person, were they symptomatic at time of contact? And then after that, I would tell you to test, but not test too soon. So a big misnomer is to go ahead and test real quick right after you have contact with someone, and that's not accurate. Chances are you'll get a negative test and you'll think I'm good, I didn't catch it. But that's unfortunately not the way it works with this virus. Is it kind of takes time to brew in your system before it's detectable in a test. So I would have you wait at least 5 days to test, go out and test. In the meantime, quarantine at home, protect your family members, maybe wear a mask around the house, kind of limit your exposure to other people. So,
and I think that was part of, I'm no educated public nurse, but I think that delay in the symptoms really was a significant major factor in trying to control the spread.
Absolutely. People are infectious usually 2 days prior to even knowing that they have symptoms, to even testing positive. And then you have the asymptomatic individuals, which throws another curveball into the whole situation where they may never even know that they had it just because they never had any symptoms and no reason to get tested.
Yeah. Well, I think all of the quarantining, and which was a little bit of how the queue began during the quarantine of all the questions, but with that isolation, either from family members and our typical support systems, it created a really major shift in mental health stability and social problems and isolation of the elderly and school-age children. And it just infiltrated every aspect of life for all of us. And I know that this group has tried to bring on guests that are helping us to be informed and ask our questions. But I guess I'd like to kind of pass it over to Jen because I know the two of you have connected right from the beginning in terms of public health, and you continue to work closely together pretty much on a daily basis. So I just want to kind of advocate and, talk about that out to the community of how our roles overlap, and particularly Jen and Darcy.
Yeah, so I do work very closely with the health department here. And I always have from the very beginning when I first came on board as community services coordinator, but particularly with the pandemic, when Darcy's doing contact tracing, she often can become aware of families that, because they now have to isolate and quarantine, that it creates a hardship for them. A lot of people work forward-facing jobs where they can't work remotely. And so then all of a sudden, when they're not able to go to work, and that could create a financial hardship for folks. It also, creates difficulties with, imagine like if Tuesday morning is your grocery day and you get the call on Monday evening that you have to quarantine and you're, pretty bare on groceries, and then thinking that, you're stuck in your house for 2 weeks and you can't get out. So Darcy has, and the staff downstairs have passed along quite a few families my way that have needed help getting groceries while they're quarantining, and whether that be that they can afford to purchase the groceries themselves and it's just they need somebody to do grocery shopping, or that they're facing a financial hardship and they need assistance with actually being able to purchase the groceries as well. I mean, either way, my office can help folks with that. We have resources from the state where we have gotten boxes of food delivered that we can give to families who are isolating because of quarantine and or quarantining because of COVID. And the good thing is the state kind of expanded parameters on that recently. Initially, I could only give food boxes to people who were isolating or quarantining after a direct COVID exposure or after being diagnosed with COVID. Now I can give those food boxes to anybody who is isolating because of the pandemic for whatever reason. So if somebody is high risk, say they have medical conditions that make them more at risk of contracting COVID and serious complications, then I can get food to them as well. So I really encourage people to reach out to me directly, and people put my contact info up. But also, if you do get contacted by Darcy or someone else through the contact tracing, and there is a difficulty with getting food or something like that, let her know, and then she will contact me, and I'll get involved. So yeah, we're always working together, and I've been working at most of the COVID vaccine clinics with Darcy and the health department staff as well, which has been a really terrific and rewarding experience for me, just to be part of, being able to hopefully put an end to this pandemic.
Yeah, I know it's just such great work. It's what we're here to do, serve our community. We're public servants. I know that, I don't want to use like the common language all the time, but the new norm and what we are now experiencing as the economy comes back, the guidelines are lifting. We're trying to continue to adapt our roles for what the community needs. In my world of business development, things likely won't ever look as similar as it did with a room full of 400 people shaking hands and networking and all of that. It'll be a little bit different in some way, but I just had one more question for Darcy, and that as the pandemic and as COVID becomes more under control, which, there are always flu season and things like that, how do you think the role of the public nurse might change going forward in serving the community, or will it still react the same? As you're saying, the role of contact tracing was always there. It was never probably as concentrated and precise, but these things were always there in terms of public safety and protection. And as COVID, starts to change and evolve and lift off of the pandemic and things like that, do you have any thoughts of what the future looks like for the role of a public nurse?
Yeah, so contact tracing has been around forever. It helped Ebola in West Africa. It helped, TB in Asia. It's always been a core function of the public health nurse. I think this public health nurse is going to be a lot of rebuilding. I think our community is injured. It's in like business standpoint, health, mental health, substance use, it needs help. So I'm going to be doing a lot more public education, maybe maybe Jen and I can work something up and try to get out there with some mental health education and support for people who may need it. So I think I'm just shifting gears from recovery mode to rebuilding mode. So that's a lot on my agenda right now is how do we come back from this, and how do we rebuild, and I hate to say this, but plan for the next one, because it's not gone. COVID's going to be around for a while. It will get better.
Yeah.
But we have to rebuild and learn from our mistakes and what we've gone through already. I think there's a lot to learn from this.
Yeah, not prepared for a pandemic. We certainly had resources and controls and measures in place, but not for what we just experienced all of last year.
Absolutely.
Yeah, it's just extraordinary. And when we think about our parents, our grandparents, I look at my mom and I think, she was born in 1938, and how much she's experienced in her lifetime, the first microwave, the first color TV, the first remote control, anything, power steering, all these things. And now it's a pandemic. And then I look at my children and I think, wow, they were born with cell phones. They could figure something out in 5 seconds that takes me 3 weeks. And now they've gone through a pandemic as young adults. And I wonder how that affects them when they look back at that. So just, Karen, any thoughts on how that looks and feels in your world of the visiting angels and working with all the various generations and the idea of a pandemic and how it affects public health and all of these types of thoughts?
Yeah, this pandemic has been very trying on the senior community. I mean, you yourself from personal experience know, Lisa, how isolating it can be. And I have found, even with my own mom, who I have been able to see, that just the weight of the world feels like it's on her shoulders. And she just, after living 93 years and seeing all the kinds of things that Lisa mentioned, this is really a doozy, and it's just tough for them to get through. But with that, we have been able to, Visiting Angels has still been able to be out there in the community and helping seniors that need extra support. And I found what Jen was talking about with her connection with Darcy and the Department of Public Health, really interesting, and how they are working together to reach people who are in isolation and need extra support. And I would like to add to the Q survey and talk about the quality that's coming out of the Chelmsford Department of Public Health. I'm glad that Jen expanded on that. But what I would like to say, I'd like to give a big thank you to your department. You guys took the initiative. You called Visiting Angels. You set up a clinic for our caregivers specifically to get in there, to get their vaccines so that they can continue working safely with the senior population. And we really are, we owe you a debt of gratitude for that. Thank you.
Oh, thank you. Thank you very much.
And I was hoping, that's a nice segue, because I was hoping Darcy could talk a little bit about the vaccine clinics. It's that they've been evolving and changing, and information from the state changes from week to week and day to day sometimes. And maybe you could give us like sort of a little rundown of where we are now as far as vaccines in the state and accessibility and, the future of clinics, both across the state and specifically, I know people want to know about, will there be more clinics here in Chelmsford, and with the caveat that the information that you give us today may be different than what it is when people are actually able to view this program in a couple of days when it gets edited and it gets put up on YouTube. So, but why don't you tell us, Darcy, about where we're at with vaccine distribution right now?
Very good point there. It can change. It's such a fluid situation. It has been a roller coaster. So as of today, I wrote this down. We have vaccinated 2,642 people in this town since January. I'm just astounded. That's awesome. I'm just pat on the back. Not just me, my whole entire team. My whole team has been amazing.
You should pat on the back. If anybody who's come through those vaccine clinics has seen how well run they are, has seen how organized your department is, and how efficient everybody is with getting people through and vaccinated in a quick, easy, and safe manner. So absolutely pats on the back.
Thank you.
All are due.
Thank you. I mean, it was awesome, and I wish we could continue doing them. So unfortunately, we got the word not too long ago that the local boards of health will not be receiving any more vaccine for first doses. So very, very clear though, anyone who we have already given their first dose to, we will honor their second dose. They have allotted us that vaccine. And so I would say if I was a person looking for a vaccine, I live in Chelmsford, I don't drive very far, there's a couple options. First option is we've been referring a lot of people to Lowell General. So if you go to lowellgeneralvaccine.com, they do have a regional clinic. Or if you want to, you can also sign up for the mass vaccination site. So the state decided that the best way to get everyone vaccinated as quickly as possible is going through these big mass vaccination sites. They're not wrong. The more people we get vaccinated, the more herd immunity we have, the quicker we can get through this pandemic. So I don't blame them on that. It's disappointing, and I'm not going to lie, our department was really disappointed when we found out we weren't going to get any more, because like Jen said, it was like a well-oiled machine. We had it down pat. We were ready to go. But, hopefully in the future, if they allot us more vaccine, we have no problem putting on clinics. But I just don't see that happening in the near future, sadly.
And there are also commercial site options as well, right? Like CBS, and which would be a different registration process than going through the mass vaccination site website and
Correct.
things like that. So
yeah, so there's a website you can go on to. It's Mass Vax Finder. Oh, I'm sorry. So it's https://vaxfinder.mass.gov. And that will search for all your smaller sites like the CVS's, the other regional sites. Or you can go to vaccinesignup.mass.gov, and that's for the pre-registration. So they did tweak it last week where you can pre-register, put all your information in, and they'll contact you. The mass vaccination sites will contact you when an appointment becomes available. So I know that was a huge source of frustration with everyone. You'd have to go through the registration process only to find out there was nothing available. And then you'd have to do it all over again. So they did switch it up. They learned and changed it, just a little bit more user-friendly, but it's still a struggle. Everyone's struggling for sure.
Yeah, I think that's part of the appreciation as we get through this pandemic and just learn how we can help each other. Just appreciate the effort. I am very impressed by the work that's being done by the Board of Health and Jen's involvement and even just Karen's effort from Visiting Angels to her clients and the community and beyond. I always learn something when we all get together, and I'm just proud to be a part of it in some small way in my little world of business development. So any last burning questions as we start to wrap it up here? I feel like we could talk for 2 hours if we had some syndication or something going on in our little show.
It's just amazing to me how we're, a year now, and I don't know, we'd have to look and see what the date was for the first show that we did, but it had to, Lisa, have been towards the end of March or so.
Yeah.
When we did, and so much has changed, but yet so many things remain the same,
Right. Yeah.
And it's just, I can't help but wonder where we'll be a year from now,
Yeah, same. I think as we just continue this teamwork effort, I think it really matters. It makes a big difference. I know I volunteered at the clinics as often as I could to support as best I can. I'm not in the health industry world, but I am trying to contribute. And I just really appreciate everything all of you three are doing in that realm. So thank you very much. And Darcy, thank you for finding the time to join us. I know you are a very busy person, as well as Jen, trying to chase the two of you down and get this. So thank you so much. I appreciate it.
Well, we can often be found together, so I don't know if that's a good thing or not, but
right now that I know
you're happening in Chelmsford when you two have your heads together.
There's like this, when you see that smoke rising above Town Hall, it's
right.
could be us.
Yep.
Okay, so with that, thank you for watching, and please follow us, and we'll be putting out another episode soon of The Cube.